From the very beginning of the pandemic, while countries around the world were closing down to try to flatten the curve, Sweden chose a different route.
Yeah, rather than lockdown, they instituted what's been called a soft touch strategy with very little in the way of restrictions. Dr. Frank McGeorge is here to explain why their approach really can't be compared to ours. Hi, Doc.
Hey, Kim and Devin. Yeah, Sweden has a population of about 10 million people, which is similar to the population of the state of Michigan. Now, they've had under 6,000 deaths. Michigan has had about 7,000, which might lead you to think maybe their approach worked, but it's not that.
While most of the world closed down, life in Sweden continued mostly restriction-free. They did limit gatherings to less than 50 people, and early on, universities and high schools closed to in-person activity. But daycare and elementary schools remained open, and people went on with life, using guidelines on distancing and working remotely. Their approach was to simply let the virus run its course with minimal intervention in the hope that eventually most of the population would develop immunity. This was met with heavy criticism, especially as their policy exacted a disproportionate death toll among the elderly. In more recent weeks, though, there's been a reversal. Many countries in Europe, like the UK, Spain, and France, are seeing a distinct increase in cases and deaths, while Sweden isn't. It's too early to say whether that means Sweden's approach was correct, but there was a price to getting where they are. By comparing them to their closest neighbor, Norway, you can get a sense of how much better they could have done. Sweden has seen over 9,000 cases per million people, compared to Norway at 2,500 cases per million. Sweden has 583 deaths per million people. Norway has only 50 deaths per million. The biggest difference between the countries: Norway instituted strict lockdowns and restrictions, Sweden didn't.
Now, looking at Sweden compared to the U.S. is far less accurate than comparing to Norway because our population is frankly much less healthy than Scandinavian countries. I think given the rate of risk factors like obesity and high blood pressure in Michigan, for example, the fact that we have similar case and death rates to Sweden in Michigan actually shows that we have made a real difference by taking stronger actions.
That's really, really interesting, Frank. So how much evidence is there that Sweden's approach might have worked?
Well, you know, Kim, until we see longer trend data on their cases and deaths compared to other countries, it's just too early to say. Although they are trying to achieve herd immunity, the estimates I've seen is that only 15 to 30% of Sweden's population might have some immunity, which is very far from the 60 to 70% necessary for herd immunity. So no matter how you slice it, they are a long way away.
Sure. Okay. Doc, we appreciate it.